All right. We are live, I think, for the SoCo Pulse podcast. And I'm Nolan Sullivan, the Director of Health Services. I think this is episode number 4. I'm super excited to be here. And I've got a new buddy in Santa Rosa, a new friend of mine or partner in program collaboration here. I've got Chief John Cregan from the Santa Rosa Police Department, who runs the wonderful Santa Rosa Police Department, but also one of the coolest programs I think I've encountered here yet, but our In Response Mobile Crisis Program. So welcome, Chief. Thank you for taking some time to hang out with me today.
Thank you so much for having me, Nolan. This is a topic that's really near and dear to my heart, and I love being able to educate our community on the great work that we're doing here in the city of Santa Rosa.
Yeah, I think, Chief, I spent 17 years in Yolo County before coming to Sonoma County. And, Sonoma County just had this reputation of like this mobile crisis pioneer. We were doing really cool things very early on. The Cahoots model, a group of folks from Sonoma traveled up to Oregon and really brought this kind of groundbreaking model back. In 2024, the state made it mandatory. And again, I think, Santa Rosa was so far ahead of the curve with our partners in South County operating the SAFE program as well. Really excited to talk about that today. And I think over that same time period, evolution in police departments around how you respond to mental health calls, when, where, how, why, has really changed. So from your experience in law enforcement, what mental health needs do you see most today? And maybe how have things really sort of evolved over the last couple of years? But, from your vantage point as a law enforcement professional, what does the mental health and behavioral health landscape look like to you and your team?
For me, it's actually this month has been 27 years for me in law enforcement. So I've seen such a transformation over the year. And what I'm seeing is, and I'm sure you're seeing with your team as well, is the need is there growing and growing and growing more today than we've ever seen it before. And for law enforcement, it's unique of that we don't deal with the high functioning. We don't deal with those who are getting the support they need, that they're getting doctors, getting medication, having all that. So some of the ones who really stand out are our youth, and our youth, and I've seen a lot of growth in that, our unsheltered population, who sometimes are struggling with mental health diagnosis, and then certainly in our unprivileged areas of our community. And those are the areas because they don't have that support, they go into crisis, and then guess who gets called out to deal with the crisis is law enforcement. And
Yeah.
so that's where I became so passionate in this. In my 27 years, it's so crystal clear to me that the right resource going to those in a mental health crisis is not a uniformed armed police officer.
Yeah.
There's a time and a place for a uniformed armed police officer, but for the typical crisis call, many times it's actually exacerbating some of the issues that are. And where I've seen in my career is that you have family members, you have those in need who are not calling out for the assistance they need out of a fear of a family member, maybe their child, their teenager at home, getting involved in a confrontation with police officers. So what's happening is they're not getting the assistance they need, or you have family members trying to transport someone who's in a moment of crisis to transport them to a hospital or to the crisis stabilization unit, and you have someone who's not in a safe place to do that. So
Right.
really, when we started having this conversation, this like really was excited to say we need to do something different. The city of Santa Rosa is growing, and it was an opportunity for our community to make some change, and really proud of the change we were able to make.
100%. And, we've got 3 different systems operating in the county today, and we're all sort of partnering and working together to kind of build one system. Depending on the stats that you look at, whether it's SAFE and Response or MST, we're looking at somewhere around 70% of calls are being responded, behavioral health calls are being responded to now without an armed police officer. And such a novel shift, right? And again, your teams probably don't want to be on those calls anyways. It's not the place they want to be, and providing that resource on demand is such a game changer when it comes to patient safety, officer safety, getting the right person on the call. Coming here, you were one of the first law enforcement partners that I met, and oftentimes in law enforcement, especially with behavioral health, sometimes it can be cats and dogs, or it can be these arbitrary relationships, or they don't often align, right? And I noticed right off the bat, you were a huge proponent of really advanced behavioral health supports. You really seem to get, kind of where mobile crisis could be a benefit, not just from a workload alleviation angle, but really from this is what the community needs. And you were just a huge champion right off the bat. What really led to that belief? I mean, again, you espouse the gospel of in response kind of everywhere you go, and you seem to be a core believer. But what really changed your mind in that space, or what really made you believe in the need for mobile crisis services rather than traditional police services?
I do strongly believe in it. And really, it was because I saw that the current system was a failing system, that it doesn't work of sitting. And I saw it just firsthand myself. As a police officer, I've gotten to work many cool assignments over my career, but one of them was getting assigned to our hostage negotiation team. And in all reality, we don't have many true hostage situations. What you have, though, is a lot of people who are getting in mental health crisis, getting in domestic situations, who are barricading themselves. They're armed with a knife, a firearm, threatening others. And our team would go out and negotiate with them and try to safely resolve the incident. And Santa Rosa, as we always have tried to been kind of like a trendsetters in this, we ended up contracting with a local psychologist who came on our team and would come out to some of these and would help us about, hey, this could be a trigger and these are things that have. And I saw the absolute difference of having our team is incredible, but having someone with that trained experience there. And that's where it started kind of planting the seed like, man, there's a different way to do this of bringing people in who have more mental health training and expertise. And I remember it was Dr. Ranish was his name. He was the one on our team. He's probably long retired by now. But it's someone that I worked with and started seeing there's a change. And then I saw law enforcement death after death where law enforcement was interacting those with a mental health crisis. And law enforcement's in a no-win situation. You may have someone who's armed with a weapon, who's combative, who's not in a mental health space to follow directions, and getting involved in shootings. And I went to a presentation I believe it was in 2017 in Oakland with Noble. And actually, the California director of NAMI was doing a presentation and was kind of exploring, was a law enforcement audience of you need to be more involved, law enforcement. And so I actually came home that day and I reached out to the local NAMI office here for the National Alliance on Mental Illness in Sonoma County with our director and reached out and said, "Hey, I was a captain at the time. Said, hey, I want to get involved. How can I help?" And I joined in 2018 the board of directors for our local NAMI, and it started with the same thing of how can we be partners in making changes. And the history of our local NAMI office was actually created by parents who had lost their children in interaction with law enforcement. So it was kind of a pivotal moment even for NAMI of having me on the board, and it started saying, what are some of the changes that we can make? And then when we saw the murder of George Floyd in 2020, that was like a catalyst moment for the city of Santa Rosa, where our city council members, our city manager said, let's do something different at the city of Santa Rosa. They knew that I was on the NAMI board and had some interest. So I was given the incredible opportunity to say, and they basically said, here's our vision, find something different, find what's there the best. And at the time, you mentioned it, the Cahoots program from Eugene, Oregon, that was getting a lot of like social media and media attention. So I reached out to the Cahoots program and just said, hey, what can I do to work with you? They were getting inundated with calls from around the nation at the time, but we jumped in really early and I was very insistent. So we were one of the first in the nation that we signed a consulting agreement directly with the Cahoots program. We actually paid them up to $50,000 with our contract, and it gave me unfettered access to their team, to be able to go to the tours of their team, to have them train us. They gave us their policies, their manuals, and we kind of said, what are they doing there in Cahoots, which was really well. And this was the crisis. They had two people on their team of a clinician, or they don't actually have licensed clinicians there, but had a specialist and then had an EMT on there. And then we looked at it and said, how can we make it even better? And quite proudly, that's what we did is we took the model of Cahoots and we made it that much better. We made it work for our community and have really seen it grown. And that was January 11th of 2022. So
Yeah.
4.5 years ago that we were able to get this program off the ground. And each year it's grown and grown.
I love that. The fact that we have a police chief also on the NAMI board is something to be commended. That's a pretty cool. You don't see that very often. So thank you, Chief, for leaning into that space. And what a great place to be in a position to make changes on both sides of that fence. You mentioned you've kind of been here since the early days, right? And so, I'm relatively new to the county. I've heard lots of rumors and ups and downs, and the county was involved and the county wasn't involved. And we went 24/7 and we have these different groups. But tell us about, from your perspective, when launching in response, what were some of the initial challenges or what have some of the bumps in the road been along the way? I think a lot of folks that don't work in this field just assume, oh, this is like a public service that you guys do and it's stable but it really has been, shoestrings and bubble gum to kind of hold this thing together to some degree. Tell us about that journey and kind of about the challenges and kind of where we've gotten to today.
The biggest challenge at first was, as I mentioned, of just kind of what is the program we want? What are truly the best practices? We didn't want to just like check a box and say we have a crisis mental health team. We wanted to really build authentic, robust, incredible team. So it took with slowing things down. Cahoots was great. I also met with the Star team in Denver. That was another emerging team. The Right team in Dallas, Texas. It's there. That's another unique team. The Portland Street Response team. I met with them. Each one of those have a little unique twist. Some involve a law enforcement officer on it, some do not. And then another incredible team is San Antonio, and they have a mental health team that's comprised of Texas. And all those were interesting. And there's actually a fascinating documentary on the San Antonio team, like Ernie and Joe Crisis Cops.
I think is it Crisis Cops? Yeah, I watched it. It's really good.
Isn't
Yeah.
it? So
Yeah.
I watched that at the time. I actually reached out to them and was able to speak with Joe Schmarro
Yeah.
from there. And he's retired now and is an advocate in this area.
He
So I
was
just
wonderful.
immersed
Yeah.
myself in hitting each one of those teams, and I would go through and interview them. What do you like? What do you not like? And then we were trying to design of like, are we going to have a law enforcement officer involved? A lot of the community feedback I got was to bifurcate it from law
Sure.
enforcement. So we went away from that, and that's where a difference between you see in San Antonio. Dallas also has an officer on theirs. Looked at San Diego as a really good model with their PERT team, and the PERT does have a licensed clinician with an officer, but they also have a separate mobile crisis team. And so I actually think that's a really good model of having
Sure.
the hybrid. So dissected each one of those teams, and then the next big issue or thing to work through is the funding. As you know, in your position, it all comes down to money. And Santa Rosa for the very first year. So we only spent Santa Rosa general fund dollars on year one of this program. So year one, we launched and it was only one team for 10 hours a day. So the cost was a lot less. We launched the team and then we really started focusing on other ideas of what we were going to do. We got a federal earmark for just over $1 million. Then we focused on ARPA for the American Rescue Plan Act that we were
Right.
going through the COVID, and then really partnering with the county of Sonoma, which is the only way this team is still sustainable today. And those were the issues of building it out. We went with the multidisciplinary team, which of course, also bringing in multiple different nonprofits and other groups. It's a lot to manage all the different visions and staff. And that was another, but at the end of the day, built a team and we started with three different teams. It's under the umbrella of the police department, but absolutely
Perfect.
bifurcated from us. And we signed a contract with Buckaloo Programs to handle the program manager and also the day-to-day operations with our system navigators, with Catholic Charities for our homeless outreach specialists. Initially, we started with paramedics from our Santa Rosa Fire Department and had all three as a multidisciplinary team. And another avenue, though, that I really see in the line of police work is that we go constantly put band-aids on the problem. We go to the call, we deal with just a crisis. So we wanted our team to be different. And so we built this big team of what we call system navigators who are working in our in-response team. And they're doing those follow-up appointments and are helping direct people to resources and help them to kind of break that cycle of psychosis as we talk about. So it was a lot. And I would say for a year, it was almost all I did. It was my full-time job. I still
Yeah.
was managing my captain role, but for a year, just really working, studying, presenting to our city council, speaking to our community, to a lot of different stakeholders in the community. And at the end of the day, with a lot of team effort, with dozens of people across our community and our city, we built something that's pretty special.
Yeah, I agree. And I think, the model is sort of evolving and changing and, unfortunately we're sort of chasing the dollars to some degree, but tell me a little bit, you have a very unique team. When I came to the county and I like to use the example, we have like the Cadillac version and like the Honda Accord version and the, affordable kind of used, whatever kind of car version of plans here, depending on kind of what you look at. And they all get you where you need to go, but they do it in different ways. Santa Rosa had a pretty impressive model, and unfortunately, because of funding and financing, we've had to make some changes to that potentially. But can you explain? You talked about it really quickly in the last question. Who is on the response and why are they there and what do they do?
Yeah, so they're driving it. And we were very strategic, even with the name in response. That we worked with a local branding company here in Santa Rosa of making it distinctly different than the police department and in response. And that name comes from us of we're in response to the cries from our community for something different. This came from our community organically. And we have the colors of gray and green. We wanted it to not look like law enforcement. We didn't want it to look like fire department. We wanted it to be very neutral. But that other part was having these neutral, non-law enforcement resources. So Buckaloo Programs has been a foundational part of our team from day one. They have a lot of community expertise, credibility in our community. So having Buckaloo as our program manager who's running day to day, and I think that's another important thing for building trust in the community that it's completely HIPAA protected. So the police department gets no patient information of names, of demographic, all we get is total aggregate data of last year we responded to 6,000 calls, this zip codes across the city of Santa Rosa, this type of service. So I think it's really important to have that separation for that data and that privacy part of it. Then we saw that so many in our unsheltered population across the city were struggling with different mental health diagnosis. And obviously not all, but it's certainly something that we see a population. But we also just wanted to work with our unsheltered population. So we partnered with Jenny Lynn Homes and Catholic Charities, who again are such an incredible resource in our community and have such ability to reach out and a lot of other resources they can bring to the table. So we have and then the County of Sonoma. This is from day one how the county, Wendy Tappan, I can't say highly enough about Wendy Tappan. So she was part of our small working group from day one from the County of Sonoma and embedded either our licensed mental health clinicians or our associate licensed mental health who are working toward getting their full license. So they were embedded. So we started with a county employee as a licensed mental health clinician, a homeless outreach specialist from Catholic Charities, and the third person, a fire paramedic. Of all three of those riding together as one team, responding out in an in-response van, and then working separately are those system navigators that aren't on the van, but they're working in our team office. And that was important. We actually got a 10-year lease on an old doctor's office right here in Brookwood and Sonoma, where it has private HIPAA protected meeting where people can come in, they can meet directly with individuals and how they're all working directly as one team. Our team gets dispatched by our police dispatchers so they can call for assistance if they need it. But what I really thought was important, we have a dedicated line for in response. But last year we had 179,000 calls come into our 911 dispatch center. Some of them don't even know about in response. They've never heard about it. So every call we're closely evaluating, is this a better resource to send in response for? Are they a better resource for this call? So that's been another thing as well of being able to send these to calls that maybe aren't coming in as a mental health call, but our dispatchers recognize that and they're able to send the right resource to the problem.
Right. That's a great example. It doesn't only just change the way that officers respond, or it's the whole dispatch system shifts and sort of evolves into this new system of care. Big shout out to Wendy. Wendy Tappan's amazing, so thank you for calling her out. I think as the Department of Health Services Director, folks would assume that I spend most of my days thinking about people's health. Unfortunately, I spend most of my days thinking about money, which is my least favorite thing to think about. But funding for things like mobile crisis, surprisingly to a lot of folks, is not guaranteed. There's not guaranteed tax dollars through the city, county, or anywhere else to provide these different systems. The state did expand back in 2024 to allow some Medi-Cal billing for the service. But again, Medi-Cal is only a fraction of the patients that you serve. It's not like when someone calls in response, you say, hey, what's your Medi-Cal number, your insurance? We can't bill private insurance today. We just don't have that capability. And some folks just don't have insurance or you can't collect it because they're in crisis. So paying for a 24/7 system can be really challenging. And I think the cost for the mobile crisis system between SAFE, in response, and MST, the county system, have almost gone up by about 5 times the original amount 3 or 4 years back. And so, as you mentioned early on, the city of Santa Rosa was very, very industrious in finding different grants and earmarks and ARP funding and some county support and county in-kind staffing. Unfortunately, most of that has run out. And so we are mostly funding in response as well as MST as well as SAFE now through Measure O funding. So Measure O was a 10-year sales tax that was passed back in 2020 by the voters here to really support mental health needs across the county. And a lot of times folks don't think of in response or mobile crisis or MST as a direct mental health benefit, but it's a huge mental health benefit that otherwise would not exist here today. Is there anything that you would share to the average Joe or Jill listening today, thinking about Measure O and its importance and the impact it makes? What are your thoughts on Measure O and kind of where would In Response be without the Measure O funding this year and the next couple of years going forward?
Yeah, absolutely. What I can say is like from the bottom of my heart, In Response would not be in existence today without the county support through Measure O. And that's why I'm such a huge advocate for Measure O. And then also, once we look toward the renewal of Measure O in the years to come, that these teams are making transformational differences in our community. In Response, the SAFE team, these teams. And I can tell you from being heavily involved with our budgets, they're not going to be able to be sustainable without this outside funding. Right now, we actually just signed a 3-year agreement that we finalized with our city council just last week for 3 more years of funding for In Response as we get toward the end of Measure O. And that's all coming 100% for Measure O. The city of Santa Rosa is not putting one general fund dollar toward In Response because we're dealing with our own structural deficit up to $17 million a
Right.
year. We're not even paying our own bills for the city at this point. So the Measure O is keeping that sustainable. We made some changes, and with that, we had to really like open up the books and look like what are some cost cutting. So
Right.
the fire paramedics has been an incredible part of this team from day one, and I'm
Totally.
so thankful for their services. But at the end of the day, it was cost prohibitive us for the amount of money. So going forward this year, we're going to be reducing the paramedics off the team, and it's going to be with the licensed mental health clinician and the homeless outreach specialist riding together. We'll still call for medical assistance when we need, and they'll be able to still be a valuable part of the program, but
Right.
they won't be one of the 3 members on there. But that's going to keep us sustainable. And so we were able
Yeah.
to build a budget that funds us for 3 more years while still having the same amount of vans. And right now we're 24/7 with 3 teams staggered throughout the day, being able to provide that support across our community. And we've seen the calls over double. So in year one, we had just over 2,700 calls in 2022 when we started this team. Next year, we went to just over 4,700 calls. In
Holy moly.
2024, we were just over 49. We're just a couple under 5,000 calls. Last year in 2025, we had 6,000 calls in Santa Rosa with our In Response team. We're tracking this year to be in the 6,500 to 7,000 calls a year. So I'm just so thankful for the work and then so appreciative of Measure O. And I think it's something that it's it's important for me to be able to go out in the community and make sure our community knows where these dollars are going, how we're using them, how the city of Santa Rosa is directly being benefiting from the Measure O funds. And I'm just so thankful that our team wouldn't survive without the support.
100%. And two kind of closing questions for you, Chief. Kind of big picture, you've been here for a long time. You've seen the police department sort of evolve. You've been through George Floyd, you've been through COVID, you've been through, sort of I don't want to say identity crisis, but a big shift in kind of where law enforcement kind of fits in and building trust and losing trust and transparent, all sorts of different things. How would you say that mobile crisis or in response has either built or impacted or degraded community trust, or what's its impact been on Santa Rosa PD with community trust? How has it impacted that in a good way, a bad way, any way? How do you feel like that maybe allows you to engage with the community in different ways?
I think it's been a way that our community's been able to see like the authentic support that the police department as a whole has, certainly that I have as chief, and the city of Santa Rosa toward being a part of some transformational changes. You can see, I mean, all of us, whatever your job may be, you can be a little protective about, I don't want to see change and feel like, well, maybe they're giving criticism about the profession I love and that I've done for 27 years. But for me as chief, I've just learned like we have to embrace that criticism and sometimes say, you know what? We can be doing things differently. And I think by just being really open and quite honestly, sometimes vulnerable in that of like, yeah, we've made mistakes. The Santa Rosa Police Department's made mistakes as law enforcement as a whole, and we want to be part of some of those changes. It's made even some who have the most distrust toward law enforcement say like, wow, they're working toward making some changes. And where I'm seeing is measurable differences in those who are reaching out to support, who maybe weren't reaching out for that support before, feeling like there's some type of like a beacon of hope out there in the community to help them. An area where we're really seeing the need even more today is on our school campuses. We've seen Santa Rosa schools struggling with finances as well, just like the
Yep.
city of Santa Rosa. We have distinctly different budgets and different operators, but we're seeing some of those changes. So In Response has been more incorporating on our school campuses. So I've been happy about that though, to see like how they can assist, whether it be
Yeah.
our local campuses, Also, we respond to calls even at the Santa Rosa Junior College. And so
Yeah,
our team is really working with the educational systems across Santa Rosa. And I think that's something that's really important. And I think our officers are seeing it because even our officers at first were a little like we're
sure.
looking at it maybe with a
What
little bit
is
of
this? Yeah,
distrust.
yeah,
Now our officers absolutely love this program. They're calling, they're asking assistance. And what
yeah,
we're seeing, there's some calls that in response can't be the solo response to. So if it's an armed individual, combative
sure.
individual, but what we have is just like that old hostage negotiation model that I worked with a psychologist, is that we have in response comes on those armed calls or combative calls, and they go side by side with the officer. They assist them, they mentor them, they provide them support. And then once it's seen as safely resolved, then in response can help with whether it be providing transport, providing assistance, providing further follow-up care. So it's been something that I think both the community has really seen the input. We're seeing people who are reaching out for the support and feeling that they have a trusted resource. And our police officers, our dispatchers are seeing what an incredible resource. And quite honestly, we're 24/7 with three teams. We're at max capacity. We multiple times a day have calls pending for in response. So my vision down the road is to look, how can we add a fourth team to be able to, especially during the peak call volumes, especially dealing with some of the increased calls in our school campuses. Those are things down the road, but it all comes down to the funding to be able to support this vision. And I think that's where we're just going to have to continue as our community ask, what are the priorities? And when your family member, when your young teenager, when your husband, wife, whoever it may be is in crisis, do you want the best trained resource responding to that call? And I think
Right.
the answer is yes for all of us.
100%. 100%. Chief, this has been incredibly enlightening and helpful, and it's been just an absolute pleasure to work with you and get to know you. And again, I think as far as law enforcement leadership goes, you definitely have a rare behavioral health sort of streak in you that I really appreciate. And it's been really nice to get to know you and work with you so far. I think we are going to struggle a little bit with mobile crisis funding over the next couple of years, but I'm really excited about billing Medi-Cal, which I don't know who gets excited about billing Medi-Cal, but that produces a nice stable revenue stream for us. And so in response is like right there, they're almost ready to bill Medi-Cal. We are starting to use a singular data system across in response, MST, and SAFE. So we'll be able to report data apples to apples and kind of compare stats and kind of streamline and connect a little bit. And really, we continue to have these partnerships where we talk about best practices and kind of common operating procedures so that if you're in Petaluma or you're in Jenner or you're in Santa Rosa or you're in Cloverdale, and you call 911 or you call 988 and you're getting mobile crisis, that response is somewhat consistent, right? It's the same kind of product for folks. Do you have anything in closing you want to share with folks, or things that you forgot to add, or things that you'd like to share with the county family about in response, or your operations?
I think the most important thing is everyone, I think, can nod their head and agree, like, okay, we appreciate this model, but get engaged. If you're not engaged at the statewide level of focusing on talking to local politicians, we saw just this year potential reductions in the Medi-Cal billable reimbursements. Like, what are we doing to get engaged? Every police agency in California would have a civilian mental health crisis team if they had the funding to do it.
Yep.
I sit on the board of directors for the California Police Chiefs Association, very loud on this topic statewide. I talk to chiefs all over the state. It's the funding. So how do we get
Yep.
involved bigger? I mean, certainly at the county level, at the city level, but really this needs to be also from the state level, from the federal level. Like, where are we putting our money where our mouth is on such
100%.
important issues? So I think when you're having conversations with your elected officials across the state of talking about how important it is, what is the funding? When we start having conversations as a county about the renewal of Measure O in the years to come, how are you going to get engaged with that? How are you going to be supportive toward this vision? And this isn't just about the city of Santa Rosa. This is about the county of Sonoma. We're all on this. And you and I are so aligned on we have to work toward the vision of one system that serves the whole city of Sonoma or the whole county of Sonoma. That we literally have family members sometimes who will come from other areas of the county who will come to Santa Rosa just to meet with our team who don't live here. And our in response team only responds to the geographical area of the city of Santa Rosa. And that just like shows me what a need there is across the county and how important it is, no matter where you live at the river, the coast, Windsor, wherever you may live, that we ought to have these same resources. And so I want to see it out. And you have the sheriff and the chiefs across the county who are all very supportive of this vision.
Yeah.
So it's all going to take our community, our elected officials working together to make sure that the funding that we have. And we also just want to continue to hear the feedback, how we can make our team better here in Santa Rosa. This is a year of that we're making some changes on our team. We're really going to be evaluating what are the impacts of that. And then I always just want to hear, like, what are things that we can be doing better with our team? How can we raise awareness of our team? So if there's community meetings or different nonprofits or others that we can be a partner with presentations, let us know and we can have our in response team show up there. We'll go out and table at different events and we're trying to raise awareness of the team so our team understands, our community understands what an incredible resource this is. But just thanks so much for the time, and the same for you, Nolan. Like, your leadership has been just so obvious of you coming in there and working with all the chiefs and working with us and being able to make some tough decisions about the funding, but lead us in a way that we can get there where we can fairly be able to use these funds across the county, but at the same time make sure that the limited Measure O funds are sustainable for the years to come for us. And I think that's what's really important. And that's why, at the end of the day, I'm happy with the agreement that we were able to come up with to be able to get our in response team sustainable for 3 more years.
100%. I think you bring up a very good point. Even though there is funding for a couple more years, that funding is very precarious, right? So first, thank you to the Sonoma County voters for Measure O, because without Measure O, we would have had to fold all three programs. Secondly, and probably equally as impactful, I want a big shout out to Assemblymember Rogers and his office. The governor proposed to cut funding for this service through Medi-Cal this year, and so that makes up somewhere around 20 to 50% of the funding for this program. So that, coupled with Measure O, really allows us to keep in response, keep MST, and keep SAFE up and running. If they had cut mobile crisis funding, which it's not a done deal, it could come back around next budget year, it would have been game over for all three programs as well. So big shout out to Assemblymember Rogers, as well as everyone else in the legislature that pushed back. The state, as you said, needs to step up. Congressman Thompson, I know you're listening to this podcast, enviously or whatever, but, we need the feds to step up a little bit too, because it is not, there is no other revenue source. There's no local tax to pay for these things. And thank God we have Measure O, but Measure O sunsets in a couple of years. So we do need our state and our federal partners to step in and continue to reinforce funding. And I hope that the voters, again, in a couple of years will push Measure O again. So, Chief, absolute pleasure to meet with you today. Thank you so much for the time. And I look forward to continuing to work on this amazing partnership and keep mobile crisis rolling for Sonoma County.
Great. Thank you so much, Nolan.
Awesome. Thank you. All right, Miss Margaret, I think we're all done.
All right. Thank you.